talk to them and do my best to answer their questions. Today, I'm very sad to say that I have to report another 2 deaths in the state of Rhode Island on account of coronavirus, bringing us to a total of 10 fatalities so far. I'm also announcing we have 77 new cases in Rhode Island, bringing us to a total of 566 cases and 60 people in the hospital. I'm going to go through the rest of my comments, and then I'll be turning it over to Dr. McDonald from the Department of Health. I do want to make a note. Occasionally, I am here with Dr. McDonald instead of Dr. Nicole Alexander Scott. Nicole is fine. She's doing great. I like to give her a break once in a while, and she also has different work that she's working on. So rest assured, she's doing great, feeling well, and Dr. McDonald is fantastic. As is the whole team at the Department of Health, I would like to make a special thank you. It's just unbelievable to me how talented the people are at the Department of Health, top to bottom, how hardworking they are. I am so lucky. I spend my time talking to other governors, and we have the A-team here, so thank you all for who you are and all that you're doing. And today's April 1st, and that means that we've been at this for exactly 1 month. It was 1 month ago today that I reported our first case of coronavirus here in the state of Rhode Island. I don't know about you, but for me it feels like it was about a year ago, not a month ago, and I wanted to take a second to pause and reflect on where we've been together as a community over the past month. Although it's been an anxious time, and although every day is long, and I know people are getting more and more anxious, it is astounding to me how much we as a state, the people of Rhode Island, have together accomplished in the past 30 days in mounting this fight and defense against the coronavirus. We were among the very first states, I think probably the first state, to extend unemployment and disability benefits to people out of work. Since that time, Scott Jensen and his unbelievable team at the Department of Labor and Training has responded to nearly 20,000 phone calls and answered over 7,000 emails. They've helped to connect tens of thousands of Rhode Islanders already with financial support. Thank you, Scott, to your team and the heroes of DLT. I want Rhode Islanders to know help is on the way. We are putting more staff on the phone lines and more staff in the process at Department of Labor and Training. We're taking steps out of the process and doing everything we can to more quickly get money into your pockets if you're out of work. Again, I say every day, the most heartbreaking stories I'm hearing now are the stories of small businesses who are closed, those worrying, will you ever reopen? Those of you who are out of work, I'm hearing you on that. We're trying every day to do things a little bit better to bring you some relief. But I want to say thank you to Commerce Secretary Stephen Pryor and his team. In the last month, we've established the 521 helpline, 521 HELP. That's a one-stop shop for any business concern. More than 1,500 businesses have contacted Commerce. They're getting back to people within a day. Dozens of companies have used the free tech help. I would encourage you, especially if you're a small business and you need a hand to learn how to work remotely or set up a website, or you need technical help, call for that. We're having great success. In the past month, we've deployed 200 local businesses who are either making critical supplies for us or donating critical supplies to us. I want to thank you. There have been over 50 local manufacturers who have offered to retool your operations to start producing critical products like hand sanitizer and masks and gowns. Again, thank you. We've massively ramped up testing. A month ago, I didn't even know what these tests were all about, and now, due to the team we have in place, we have 6 swabbing sites all around the state and 6 labs processing these tests. We're completing more than 500 tests a day. which puts us on par with Massachusetts and ahead of many other states. And I'm very proud to let you know that by tomorrow, we'll be at a capacity of 1,000 tests a day. So I have a special message to our primary care providers. Primary care providers, start sending us folks. By tomorrow, we'll be at our 1,000-person-a-day capacity. We're relying on the primary care providers to screen and triage patients and go ahead and start making appointments for getting patients swabbed, because we're going to be able to have these tests happening. Again, this is unbelievable, because a month ago we were running, essentially no tests or a few tests in one lab in the basement of the Department of Health building, and now we're doing 1,000 a day, 6 centers, staffed by the National Guard, and 6 different labs. Thank you to the team who's made that happen. We have been, as I've told you, scouring the world for the critical supplies that are necessary to keep people safe. In the past couple of weeks, we've procured 500,000 respiratory masks, nearly 500,000 surgical masks, and we are ramping that up every single day. We tried something new. We were the first state in the country to say that we were going to allow our kids to continue to go to school, but to do it through distance learning, and we're making it work. It's not easy, but we're making it work. We have over 140,000 school children in public schools today, right now, receiving their education. It's in 310 schools, and 97% of school leaders are reporting positive feedback. If you're a teacher, if you're a student, if you're a principal, if you're a school resource officer, take a minute and give yourself a pat on the back, because it is phenomenal and I'm proud of the work you're doing. So how is all this work happening? Every day I come up here, I stand alone with 1 or 2 people behind a podium and tell you, I do my best to explain to you where we are, where we've been, and where we're going. But the truth of it is, I have a whole army of people behind me working around the clock to protect you and to protect the people of Rhode Island. And so I want to take the next couple of minutes just to give you a view into all the work that's happening behind the scenes. You hear, when you read the paper, watch the news, watch the national news, you hear a lot about ventilators, masks, hospital beds, and all that's important. But here in Rhode Island, we have a much more comprehensive response happening. It's not where it needs to be. That's why we get up every day and work harder. But I want to take a minute to give you a peek into what's happening, hoping that you'll have some confidence that we're getting ready for the surge, which will come, and that we're going to be fine. It's going to be hard. There will be a lot of sick people. There will be more fatalities. It'll be really tough. But we have teams in place working now to make sure we're doing everything we can to get us through as safely as we can. So, for example, a few weeks ago I tapped Steve King to run our supply chain for PPE. Steve runs Quonset. He runs the Quonset Business Park. He does a fantastic job. He got a call from me late on a Saturday night. I said, Steve, I'm calling you in off the bench. I need you to assemble a team to do nothing but 24/7 get us, the state of Rhode Island, PPE. And he's doing that. He's doing that in every way possible. Local manufacturers, FEMA, on the phone in the private market. He has a team of people working for him, and all they do all day is purchase for us masks, gloves, gowns, face shields, goggles, N95 respirators, regular surgical masks. Right now, 2 weeks ago, we didn't even have this work stream. Today, right now, we have on the way to Rhode Island over 5 million N95 masks, over 3 million surgical masks, hundreds of thousands of gloves, hundreds of thousands of gowns. We have local manufacturers retooling their systems to produce some of this equipment for us. It's not here yet. Every day's a battle. Sometimes when the order is made, federal government comes in and cancels it. But you should know there's a team on it. They're professional. I check in with them every day. And millions of resources are coming into our state in the coming weeks to keep our healthcare providers and our first responders safe. Testing. As I just announced, by tomorrow, we'll have the capacity in our system to swab 1,000 folks a day and test 1,000 folks a day. Thank you to all of you who made that possible. Soon, in a week or two, a week or so, I'd like to have here in the state of Rhode Island same-day testing widely available. That's where we're going. I don't know exactly when it'll be. That's the goal. We're working it every day. Contact tracing. We have a whole team that does nothing but contact tracing. This is a huge effort. Yesterday, I asked you to do something, and I'm going to ask you again today, because if you haven't done it, I need you to do it today. Contact tracing will save lives. It sounds simple. It's a lifesaver. I need every single Rhode Islander get a notebook, and at the end of every day, while it's still fresh in your mind, I want you to write down where you've been and exactly who you've been in contact with, and write the date on it. It should be very easy, because you should be saying, I've been in my house and in contact with my family. But for those of you who have to go to work, or maybe you went to the park, or maybe you go for a walk, or maybe you went to the grocery store, I need you to write it down every single day, so that if you do get sick, or someone in your family gets sick, our contact tracing team has a better ability to figure out who you may have spread the disease to. Where we want to go with contact tracing, and what our contact tracing team is doing, is a much more technology-enabled contact tracing method. So right now, we have a team of technology folks, some of whom I brought in from the private sector, some of whom are volunteering, some of whom are in the National Guard, some of whom already worked in the state. All they do all day is work on how to figure out how to do the best, most sophisticated, most accurate, most real-time contact tracing. So again, I hope in a week or two, I'm able to say to you, we can have much more widespread contact tracing, and we can track people based on their symptoms, based on their location, and we can do it in a tech-enabled way. Until then, thank you to the hundreds of people who we have doing this manually. It's very difficult, and they're doing a terrific job. We have a team doing nothing but quarantining. Quarantine is also the key. As I've said so many times, I cannot and will not let this economy be closed one more day longer than necessary. In order for me to reopen the economy, we need testing, contact tracing, and quarantining to be effective. So what does this mean? And we have a team on quarantining. They are finding hotels so that folks who are homeless can quarantine effectively. They're people who are in congregate settings, group homes and the like, or people who are housing insecure. We need everybody to have an effective place to be quarantined. So we're marshaling those resources and getting facilities available. We need to figure out how to track people in quarantine to make sure that they actually stay in their quarantine. We're working on that. We need to figure out how to deliver essential services to people in quarantine. You can't ask somebody to stay in their house, but then not give them a hand getting groceries or medicine or essential supplies. So these are all the things that we're working on so that we can have effective quarantining. And again, I just want to give you a feel for how comprehensive the work is that is happening. Surging, I get asked all the time, are we going to have extra hospital beds? Yes, we will. We will need them. I want to say thank you to the hospitals. We're talking to them every single day. Every hospital is figuring out the surge capacity within their facilities. Over and above that, the National Guard is working with the Army Corps of Engineers. We're going to have to set up what we call field hospitals, another 2,000 beds in different locations that are not now hospitals, but that will be functioning as hospitals. So I have a huge team of people doing nothing but that. Identifying the locations, purchasing the hospital beds, purchasing all the equipment, figuring out how we're going to staff these hospital beds, changing and relaxing all the regulations and liability that go along with setting up new hospitals with 2,000 additional beds. So to those of you working hard on that, I want to say thank you. You're in great shape and you're doing a great job. I get asked every day about modeling. We are working to finalize our model. I am not putting a model out in the public until I feel that it's complete and ready and as accurate as it can be. And we're not there now. I have a team of folks working on that. We are leveraging people at Brown University. We have a team at Johns Hopkins validating it, and the folks at University of Washington validating it, and the CDC validating it. So soon, sometime next week, I'll share with you our best estimates on the model. Here's what I can tell you now. There will be a surge. It will be a steep increase. I'm going to be reporting numbers that it's not going to make anyone comfortable. Exactly when the surge happens, what the peak looks like, when the peak comes, I don't know right now. We have estimates, but we are working it, and we're going to refine it every day. But as I've said so many times, we are working for the best and planning for the worst. I also can tell you this. The single most important variable in all of these models, and I've looked at them all, is the level of compliance with social distancing. Some of you have pointed me online to the model online, the IHME model. It assumes 100% compliance with social distancing. I can tell you right now, we don't have that. So what I would suggest to the people of Rhode Island and to those of you anxious to see a model, the most important thing you can do if you want to change the shape of our curve is to obey the directions around social distancing. Stay at home. Don't congregate with people. Stay 6 feet away from people. The more we do this, the better the model will look. And then finally, we have a big team working on what I keep referring to as the new normal. So one of these days, hopefully soon, I want to be able to let you go back to work. But that won't be a flick of the switch. That will be industry by industry with new rules, regulations, and standards. And so Stephen Pryor, our Commerce Secretary, is leading a team in consultation with businesses to figure out how can we safely let you open up for business. And that will be different industry by industry. What it means for a restaurant to open safely is going to be very different than what it means for a law firm versus a hotel, versus the convention center, versus the casino, versus manufacturing. But I don't want you to think I've forgotten about that. Top of my list every day is when can we get folks back to work and how do we do it? So we're right now working through that work so when the time comes, we're ready. I want to say special thank you to the National Guard. When I began, I said that there's literally an army of people behind me. That's not an exaggeration. We have 600 members of the National Guard currently full-time deployed, probably on our way to 1,000. They're doing everything you can think of, and they're unbelievably professional and hardworking and talented and dedicated. So thank you to General Callahan and your troops who are on the ground helping us make this happen. A couple announcements. As I said earlier, everyone who's in quarantine, we need you to stay home. For you to stay home, you need a hand getting groceries. And by the way, I know how hard it is to stay home. So I'm very pleased to announce today, as of today, we have a new service called ridelivers.com. The service is RI Delivers. You can access it by going to the website ridelivers.com or just call 211. And it's a food delivery service. So if you're stuck at home because of the quarantine, we need you to stay at home, but we want you to eat and be healthy. So you can go on ridelivers.com or you can call 211, and we've made arrangements for food to be delivered to you. At this point, I want to give a big shout out and thank you to Rock's Grocery Store, local grocery store. They are our partner in this, and they're going to be doing most of the food deliveries. I should note that everything I'm doing when I'm looking to set up a new service, looking to manufacture something, looking to set up a new call center, wherever possible, I want to use local talent and local businesses. And there is no silver lining to this crisis. I'm not saying there is. I just want you to know that, in this case, Rock's was really hit hard. They're not as big as some of the bigger chains. And so this is a way for them to work with us to help their business a bit. And they're being terrific in stepping up to help the community. And we're trying to do things like that wherever possible. Also, there are many, many volunteers who are making this service possible. And so to you and the hundreds of other volunteers that we have, thank you for what you're doing. We could not get this done without you. A couple other notes. The burden on small businesses is just extreme. I don't know what word to use. It's heartbreaking, it's heart-wrenching, it's really tough. And I feel for you guys because you've played by the rules your whole lives. You've been frugal and hardworking. You've put everything you have into your business. And frankly, you just can't sustain being out of business for a month or two. So every day I ask myself and I ask my team, what more can we do? What more can we do for small businesses? And so today I have something to announce. Soon, very soon, the federal government stimulus is going to kick in. Rhode Island is going to receive $1.2 billion, thanks to the hard work of our federal delegation. And much of that money will help us to help small businesses. But that's weeks away. I wish it were sooner, but it's weeks away. And I'm hearing from a lot of you, hey, I can't make it another 3 weeks. I can't make it another week. So here's what I want to tell you. If you're a small business who just can't make it, I need you to right away pick up the phone and call the SBA. Call the SBA and get that application in process. Then, once you've done that, if you can't wait for whatever time it takes them to get you the money, I have a new announcement today that we here in the state are launching a short-term bridge loan program for businesses that have 10 employees or fewer, designed to get you immediate cash to help get you that bridge to the SBA, which will get you the bridge to the federal money. I wish it were easier, but it's the best we can do right now. This program was developed in partnership between the Commerce Department and the fantastic leadership of Stephen Pryor with the Local Initiative Support Group, known as LISC, and the Rhode Island Hospitality Association. And thank you, Dale Venturini, for being such a great advocate on behalf of restaurants. You brought this to our attention, and we're working on it. We're acting on it. We're starting out with $2 million in this fund, $1 million from Commerce and $1 million from Bank of Newport. And if there's any other bank out there who's so inclined to want to give us a hand, step up beside Bank Newport and pitch in another $1 million to this program. These small businesses can't wait. Don't let them wait because they won't be able to recover. So it's $2 million additionally. These are meant to be small loans. I'm talking thousands of dollars, not tens of thousands of dollars. Quickly available to you after you've already applied for the SBA loans that have been made available. If you didn't follow any of that, or it was confusing, remember this. Just call 521-HELP. If you're a small business, you're struggling, you need a little bit of cash right away, 521-HELP, help is on the way. If you're a bank and you heard that, pick up the phone and call me or Stephen Pryor and tell me you'll put $1 million into this, because I have a feeling we're going to run through that $2 million very quickly. Yesterday, I want to move to a different topic. Yesterday, we received a question about visitation for parents who have joint custody over their children. And I want to clarify the guidance that we gave. If you are parenting your kids under a family court order, that order must be followed. So the family court's orders are in existence and ought to be followed, need to be followed, must be followed, even during this period of the coronavirus crisis. So I know the strain of this virus is immense, and I know that there's a good deal of tension in all of our families right now. But I need to ask parents to do your best to communicate with one another, follow the family court order. If you feel you need to modify your typical visitation schedule on account of the new rules, then just communicate with one another and come up with different arrangements that work for your family through your collaboration and patient communication in compliance with the family court order. If you can't work it out, then get in touch. Then the family court is open for emergencies, and you can get in touch with the family court, or you can get in touch with your lawyer, or you can get in touch with Rhode Island Legal Services. So the order is in place. Try to work things out between yourselves. If you can't, reach out to the family court, reach out to your lawyer, reach out to family services. The family court's open for these emergencies, and they'll get you through it, and they'll talk you through it. Finally, to end on a somewhat happier note, today the United Way has said that today is 401 Gives Day. It's a great thing. So many people are in need right now. If you're in a position, some of us are lucky through this, and you can give today to the United Way's 401 Gives. You can choose to donate to more than 375 nonprofits in Rhode Island who are making a difference to our state. So that was a mouthful. Thank you for bearing with me. I'm going to turn it over to Dr. McDonald and then happily answer your questions.
So thank you, Governor. So we do have 77 new cases in Rhode Island, and the ages really affect people from children up to folks in their 90s. And as the Governor did mention, we did have 2 fatalities. And so one person was someone in their 50s, another was a man in his 70s, and both individuals did have underlying medical conditions. That means we've lost 10 Rhode Islanders with COVID-19. We don't have any new fatalities to report from nursing home residents beyond the 3 that Dr. Alexander Scott spoke about yesterday. 2 of those fatalities were from the Golden Crest Nursing Center in North Providence, and one was at Oak Hill Health and Rehabilitation in Pawtucket. While we do have no new fatalities to report from either of those facilities, we are continuing to work with the administrators to manage these 2 very complex and challenging situations. Both facilities have had a small number of staff who tested positive. The rest have been patients who have tested positive. The administrators of these facilities and their medical staff have worked very closely day and night with the Department of Health, and we're working in partnership, and it's very productive to see what's happening in that space. We are trying to ensure that the people who are positive at these nursing homes are effectively distanced from other residents in the nursing home with some cohorting going on. One of the concepts we want to get out for nursing homes, and this is really true for everybody, you really want to minimize contact between you and other people. So in a nursing home in particular, we want to consolidate the care with as few people as possible. If you keep few people as possible dealing with the person in the nursing home or long-term care facility, you really do minimize the risk for the nursing home resident. But that's really true for all of us. If we minimize contact, like the governor said earlier, you don't want you around more than 5 people, but don't go find different groups of 5 people to hang out with. The less people we're all around, that minimizes the risk for all of us. And if we all work together, doing our social distancing, this physical distance from each other, we're more likely to be successful and get through the surge okay. So thank you. I'm going to turn it back over to the governor.
Good afternoon, Governor.
Good afternoon.
And to everyone at home, we begin with this question. Progressive groups say that low-wage workers are keeping the state afloat and deserve a living wage, especially low-wage workers who are continuing to work in an ever more dangerous environment. Your thoughts?
So, a few thoughts. First of all, the sad reality of this crisis is that it's low-wage workers who are being hit the hardest. If you look at who's been laid off in the largest numbers, it's lower wage individuals. And those are the people who can least afford it, which is why we're working so hard to provide, quickly get unemployment insurance out there. It's why I fought so hard to make sure that the new stimulus bill included unemployment insurance for small business owners and independent contractors. Of course, I've always supported a living wage. Before the crisis, I'm an advocate for increasing minimum wage and having a livable wage, and we're doing everything we can. For those of you who are presumably maybe they're asking about healthcare workers, they are absolutely on the front lines, and yesterday, Dr. Nicole Alexander-Scott gave guidance that they should all be wearing surgical masks every day when they go to work, and it's why we're working so hard to get the necessary masks and gloves and respirators so that those folks who have to go to work and for whom we're very grateful that they go to work, we're doing everything we can to protect you, and we're going to continue to do that.
You mentioned earlier, and the question is, why does the federal government cancel some orders of PPE? Is it being diverted to other areas like New York?
Yeah, excellent question, and it gives me an opportunity to share the reality of what we're dealing with. So 2 weeks ago, President Trump said, somewhat famously, he doesn't want to be a shipping clerk, and gave clear direction that the governors we were the front lines. The federal government would support us, and they have done that, and Director Gaynor has been excellent in supporting us with access to the national stockpile, but in the first instance, we're on our own, which means I begin every day on the phone with diagnostic companies, manufacturers in China, doing everything I can with the team to purchase our supplies. At the same time, every other governor is doing the same thing, and the federal government is in the market. So it's literally a globe, and 142 other countries who are dealing with corona are also in the market. So the short answer to Brian's question is yes. At the same time, I might be lining up an order with a diagnostic company. FEMA is in the market, making a much larger purchase for the federal government, and then shifting that maybe to New York City, maybe to New Orleans, maybe some to Rhode Island. But it is a very opaque system, to say the least. And so what that means, the direction I've given my team is you can't let up. Even when we think we're in good shape, you have to go order more. And by the way, earlier today I was on a phone call, and governors are seeing this in every state. So we're just going to continue to do what we can do. And the only good news is that FEMA says that a lot of what they're purchasing, they're going to start pushing into the private market. So hopefully there'll be more availability in the days and weeks to come.
Governor, could you explain why we don't hear about numbers of recovered people? Is there a reason why that number isn't mentioned?
Would you like to take that?
I'd love to. Yeah. So thank you, Governor. So I think like a lot of departments of health in the United States and across the world, we're really focusing on identifying cases and then doing contact tracing. The vast majority of people with COVID-19 do get better, so 85 to 90% recover, rather uneventfully. It's a mild illness. It's so mild, quite frankly, that some people don't even know they have it. We do keep track of people, though. Like I can tell you right now, although there's 60 people in the hospital, 33 have been discharged. So we are keeping track of it, though, but we just haven't been talking about it. We're focusing on what we think right now is most important, is identifying the cases, doing the contact tracing, and then getting the appropriate people into quarantine. Thank you.
Thank you, Dr. McDonald. The next question is, what is being done to ensure that essential and state workers are being kept safe and following guidelines like spacing out employees and in groups of 5 or less? Are spot checks being done here as well?
Great, thanks. Yes, again, I've said it every time I've had a chance to be up here, we're really grateful for the state employees who are providing essential services, whether they're Dr. McDonald's colleagues, the Department of Health, or the folks on the phone at the Department of Labor and Training processing your unemployment claim, or on a busy day like today, the people at the Department of Human Services that are ensuring that essential benefits get out to Rhode Islanders most in need. We're working closely with every department to make sure that we can do things like social distancing and enable remote work wherever possible. We have nearly 2,000 state employees who are now teleworking, which is not something 3 weeks ago we would have been able to say we could do, but this crisis has pushed us to try new things. We're particularly grateful for our partners in organized labor, all the unions who are representing state workers who have given us extra flexibility and allowed us to work with them. And so we're doing things like split shifts. For example, the folks at the DMV who are still seeing Rhode Islanders by appointment only, there's 2 groups, and so the teams rotate so that we can enable better social distancing to make sure that that group isn't in the same building at the same time. And so we're trying a variety of innovative strategies. State government is not always known to be flexible and innovative, but we're working hard, and we wouldn't be able to do it without our partnership in the unions. And we're doing our best to make sure that we can continue to provide these essential services, but to do it safely and to keep our workforce safe in the process.
Thank you. Dr. McDonald, despite hearing that many people have recovered, our viewers are pressing us for hard numbers. Can the Rhode Island Department of Health estimate the number of recoveries or perhaps the number of active COVID-19 cases?
Yeah, so I get why you're curious. So we do have the 566 cases that we know about, but we actually know that there's many more people, only some more people, who've had COVID-19 who haven't been tested, and that's not expected. In other words, we know some people have a mild course of it and get better. We have every reason to believe that well over 90% are recovering quite quickly and doing quite well with it. So I just think that's a context setter for this. You know, just keep in mind, too, as far as context goes, we are on day 32 since our first patient, and it's really only the 13th week since this world has even known about this disease. So we're really focusing on what we believe to be the most important thing, which is identifying the cases. And that's why I'm excited about the testing that's going on. We've really done a lot to ramp up the testing, and you're going to see more testing starting tomorrow. And as we get more testing done, we are going to identify more cases. And I think that's going to be very helpful as we get more people identified, more people quarantined, and I think it'll help us get ahead of this. Thank you.
Governor, does the state have any plans to implement digital contact tracing using mobile phones? If so, please describe how this would work.
Yes, so as I said, right now we have a technology team looking at all the different ways that we could leverage existing technology to do better contact tracing and symptom tracking. The answer is there will be use of a mobile phone, definitely. We are attempting to weave together different off-the-shelf technology. So maybe we might use Salesforce for a certain piece of it, another telemedicine application for another piece of it. So it's premature for me to say that we have a solution today that I can roll out to you. But as I said, I hope that a week from now I'll have much more to announce, and we will have mobile apps for people to frankly do everything. You know, we're trying to get everybody to stay at home. So we're trying to move everything we can to mobile phones as it relates to telehealth, ordering appointments, tracking symptoms, tracking quarantine, etc. So just hang on a little longer and I'll be able to make some announcements with some details.
The next question asks, many workers at Electric Boat in Quonset and on construction sites are worried they are not social distancing, and if they complain, they will lose their job. Can anything be done?
Absolutely. So hearing this, I will now call down to Electric Boat. You know, we are doing everything. That's not okay. You should not be required by your employer to be in close contact with anyone. And we are going to do everything we can to clamp down on employers who are not following the directions around social distancing. So if you are worried about it, call us. Send me an email. Send an email to the governor's office. We get plenty of emails every day. I will look at it and I will do my best. Call the Department of Business Regulation. Don't call the Department of Labor and Training because they're busy processing unemployment claims. But call me, call DBR, call 521-HELP. It's not okay. You should not have to work in those working conditions. And the more I hear about it, the more I can try to do something about it.
The next question is about the small business loans that you just announced. What about businesses with more than 10 employees? Many say they can't pay their rent today because of the closures.
Yes, I understand that. So, as I said, I've called 521-HELP. We'll see what we can do. I'm sure you've already called your bank, but if you haven't, obviously do that. We're working with banks to ask them to be lenient. We set up a special arrangement yesterday with the Superior Court. So to help you work through this situation, you can call the Superior Court. Call the SBA. The SBA loan program is for all small businesses, not just 10 or fewer. And every day I'm trying to come up with new solutions. So just stay tuned right here, and we're going to do everything we can to get some more money out as fast as possible. Soon enough, the federal money from the stimulus will be on the street, and we'll be pushing that out to you. So just hang in there if you can a little bit longer. Call 521-HELP if you really can't make it, and we'll do our best to help you out one at a time.
Governor, what is the state doing to mitigate the negative impact of the coronavirus crisis in the census, especially in hard-to-reach communities?
So we are increasing our advertising and outreach to those communities through this time, and the federal government also is providing additional resources for that. So the answer is we're going to spend more money and we're going to work harder, and we're going to try to message through the coronavirus.
In addition to CCRI, URI, RIC, Kent Hospital, and Rhode Island Hospital, where else in Rhode Island can people go to be tested for the COVID-19? If those are the only 5 sites right now, are additional locations being looked at, and if so, how many?
Mm-hmm. So let me say this. You should not be going to those sites at all unless you have an appointment. So if you feel sick, you should pick up the phone and call your primary care physician. And then talk to the physician and decide if you should be tested. If you should be tested, your primary care physician will get you an appointment at the appropriate center in order to get a test. If you don't have a primary care physician, call an urgent care center. If you don't want to or can't do that, call the Department of Health's hotline. At this point in time, as I said, starting tomorrow, we have the ability to swab and test 1,000 people a day. These are by appointment only. If you just show up or if you drive through, you will not be served. So the message to primary care providers is start sending us your patients. The message to the people of Rhode Island is get in touch with your primary care provider and we'll get you a test if a test is warranted.
Was the president on today's call with the governors, and if so, what was discussed?
No, today's call was hosted by the National Governors Association, and it was a meeting of just the governors, and it was really just an opportunity for us to share good ideas, what's working in different places, and also collate and put together our shared concerns so that we can together as governors, in a bipartisan way, advocate to President Trump and the Congress for what we think we need to fight corona in each of our states.
Next question is about these press briefings. The White House, Governor Baker, and Governor Cuomo all have reporters at their daily briefings. Why not have 10 reporters attend, sitting 10 feet away from each other?
Because that would violate my own order, and I am in the business of following the rules.
And the next question, can you clarify your orders regarding beaches and parks? Some confusion yesterday when you said parking lots were closed. Also, if parks and beaches are closing, why wait until Friday? Why not do it immediately?
Yes. So we are closing the parking lots. So the beaches and the parks will be officially closed. There will be barriers there. You won't be able to park your car. We're asking you not to park your car. And there'll be barriers at the entrances. So we're trying to make it hard for you to access the beaches. Having said that, if you're in a position that you can walk there and you want to go for a walk, then that's fine. We wanted to wait until Friday because it takes a little bit of effort to get the barriers up, get organized, and DEM asked for a bit of time to get organized and also to let people, make their plans. The whole point of this, by the way, isn't to prevent people from going outside. In fact, I'm encouraging people to find ways to exercise, find ways to get fresh air, find ways to get a little vitamin D from the sun, but don't do it in big groups. So the point of this is if you can go to the beach or a park for a walk with a friend or two or your kids, fine. But we were seeing too many people bunched up, crowds of 5, 10, 15 people in close proximity, and so we felt it was the right thing to do to just shut it down.
The next question brings us full circle to the first question. Would you be willing to make an emergency funding request through Commerce RI to increase the hourly wages of CNA workers in nursing homes, hospitals, and the home health agencies?
So at this time, what we are doing is I'm in very good contact with the hospitals, nursing homes, and the labor unions that represent CNEs and nurses and social workers. Soon, the federal stimulus money will be made available to hospitals and other healthcare providers. And then at that point, I would say that the individual institutions, healthcare institutions, will have to figure out how to use that additional capital to keep the lights on and keep folks employed and to have the PPE necessary. And I would just encourage each institution to do what they think is in the best interest of their employees and their patients.
And our last question for this Wednesday briefing, can you explain why, in your view, in terms of their role in controlling fiscal elements of the state and hospital infrastructure, it isn't necessary for the General Assembly to meet virtually right now?
Because right now we are not in a position, we pass the budget typically in the end of June, and we're going to have to get to the business of doing that. But at the moment, on April 1st, we're still in crisis management mode. And so, we couldn't convene to pass a budget right now. There's way too much uncertainty. We'll know a lot more, after April 15th, how many people pay their taxes, after we get the final details of the expenses for COVID and how much will be paid for by the federal government, frankly, what the shape of the curve looks like. So for the next 30, 60 days, we have to manage the crisis, keep people safe, and ready the infrastructure of our healthcare system. Then we will get to the business of seeing what laws need to be passed, how do we deal with the budget, and at that time, I'll figure out with the General Assembly what's the best, safest way for them to do their business.
Thank you, Governor.
Thank you.